for talking to us today. So I wanted to ask you a little about the nerve studies that you had. You had some nerve studies done a few years ago. So there was some suspicion maybe you had carpal tunnel going on in your hand. So tell me about the whole experience of having the nerve studies done.
So I was very nervous. Let's just put it that way.
Right.
I'm not a fan of needles.
Right.
But the gentleman himself was very nice. But the actual study, when they're applying all these needles into your skin all the way up to your neck, I did not make it all the way through.
So not a fun experience.
No, it literally hurts because they're tapping on these needles and it's just shooting pains through you.
Right. Did you have to wait a long time for the nerve studies to be done?
No, I think maybe 3 days.
Okay, so you didn't have to wait very long.
Yeah.
Okay, because a lot of patients have to wait a long time. So I basically want to contrast that. So a lot of patients that have carpal tunnel syndrome and other nerve problems, mainly carpal tunnel syndrome, will have nerve studies done. And nowadays we have ultrasound, right? So ultrasound, and we have a lot of very good evidence nowadays that ultrasound, a very simple modality which basically takes sound waves and turns into a picture that we can see, is just as good, if not better, than the nerve studies that she had done that were very painful. So Lane, if you could just zoom in on the little screen right here, and we'll kind of show here what we're doing with ultrasound. So actually show our wrist here first. So we have the ultrasound basically placed here right at the level of the wrist, right where the carpal tunnel is, just proximal to the carpal tunnel. I use the example of a tunnel, right? So you have the tunnel here. What happens before you go into the tunnel is the traffic builds up before you go in the tunnel. So go over here to the ultrasound machine. So the ultrasound machine here, right, we have the contents of the carpal tunnel. So right over here, this is the ulnar artery, right? And then we have this black bean structure right here. This is actually the nerve. This is the carpal tunnel nerve. And what I'm going to do is actually pause it right here, hit a little button that pauses the ultrasound. And I can actually measure where that nerve swells up. And basically what we're doing is we want to measure how swollen is that nerve. Now they've done a lot of studies and shown that patients normally without carpal tunnel, our normal nerve should be less than 10. Right? And you'll see that Kelly's here, who's been struggling with carpal tunnel for many years, since 2021. Her nerve is, looking down here, at 13. A little bit, I measured her at 14 just a few minutes ago, but that certainly confirms the diagnosis. So, pan back out, Langdon. So that took us all of a few minutes, probably about 30 seconds for me to do that, and gives me all the information that I need to say that Kelly has carpal tunnel, and confirms what I found on her exam, and also we just ask her questions. But thank you so much, Kelly, for agreeing to do that.
Thank you.
All right.
That was no pain.
Great.